Cool. Would you like to lead us in the Pledge of Allegiance?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome to the Shawnee County Board of County Commissioners. It's Thursday, October 8th, 2020. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. So
Good morning.
Good morning, everyone. That's good. First item.
Item 1, proclamations, presentations. Number 1, Sheriff's Office update. Sheriff Hill.
Good morning, Commissioners. Sheriff Brian Hill with the Shawnee County Sheriff's Office. I just wanted to come this morning and give you guys a brief update on some of the activities we're doing and some of the crime strategies throughout the county. Here's some of our recent stats that they've pulled. Our warrants arrests have increased. As you can see, 14% for the felony warrants, 81% for the misdemeanor warrants. We've had actually a decrease in burglaries throughout the county. It's went down 13.2%. I attribute that to some key arrests of some frequent flyer individuals that were taken off the street. Our illegal firearm seizures have gone up considerably. It's a 105% increase of prohibited persons that are carrying firearms that we've been able to make arrests on. And our drug arrests throughout the county have increased 66.7%. And I attribute a lot of that to the drug task force, where we're partnering with the other chiefs of police and the jurisdictions and TPD as well. A couple of things that we've rolled out the Sheriff's Office. We've started the Sheriff's Sport Team, which is a proactive operational response team. At the Sheriff's Office, a lot of the activities are we either do or don't do is manpower driven. We have a 7-man detective division, and at times when we roll out proactive operations, it ties up that entire division. This is an ancillary duty. We've had 10 individuals apply for this, so they will be undergoing some specific training as far as some narcotics investigation, some basic detective investigation, and they're going to be a supplemental manpower unit. So when our detectives come across opportunities to do proactive policing, they'll have a ready-made manpower that they can tap into of guys who are equipped and trained and ready to assist in that endeavor. I think that will plug up a big hole in our investigative procedure. A lot of the things that we don't do proactive is based upon manpower allotments. And we've also are rolling out this motorized posse. This is honestly just a search and rescue initiative. We get numerous calls throughout the county of runaway or lost children, walk-away elderly people, and really the response to that, the detectives respond. They go to searching areas, but they still have priority calls that at times they get taken away to priority calls, and they're going back. And any given time, 2 or 3 deputies in a 550-something square mile county is a drop in the bucket for search areas. So we've had a lot of interest so far. We just rolled this out the other day, and we plan on having squads of these people through different parts of the county, north, south, east, and west. We'll provide some trainings, just like normal posse members, and their function will be to assist the Shawnee County Sheriff's Office with search areas out in these rural county areas, and I see that as a positive upgrade for our agency. And I'll stand for questions.
Do you have any
All right,
questions?
Chairman?
Yes.
Sheriff, Brian Hill, Brian Cole came and talked with us here a week or so ago about doing some advertising and really trying to get more geo-fencing is what they called it, so that if you were in a specific area, you were getting, updates saying, hey, would you consider applying to the Department of Corrections? And it got me to thinking that, when I attended the Ambulance Advisory Board, we were talking about that same geo-fencing, trying to focus it in on when you have an emergency, sending out the right people to the right places, responding more quickly with the technical advantages that we have now. Are there ways that our consolidated 911 might be able to be more effective? Because our 911 covers ambulance, Topeka Fire, rural fire, Topeka Police, and the Sheriff's Office. So we have 5 different law enforcement or first responders, and being able to send out the right resources at the right times, or there's some things that we might be looking at with 911 that would make it just really up the speed.
There are some things that we're looking at rolling out with Ms. Burgess at the Communication Center. They, for the last several years, honestly, have been trying to save enough money to purchase this program that would be a huge benefit to Shawnee County, I think. And actually, I have them working on a presentation that I'd like to show back up and present the benefits of that. I've worked with the Topeka Fire Chief. He is really adamant that he believes it would assist them in their response throughout the county. Now, that entire system does have a fairly hefty price tag, and they're working out every year it goes higher and higher for the initial setup of that. But it's basically a scripted dispatch response, and you get into a lot of the larger cities that has 100 dispatchers or so. They implement this. It really helps out the first responders, because although our dispatchers do a really good job, from one dispatcher to another, you might get a little bit different information depending on what questions they ask. This system would actually give our dispatchers the questions to ask, so they're reading them off the screen, so it's the same information that's getting sent out all the time. Yeah, I will put that together and bring that over here, because I do think that's very beneficial, and we are working toward that.
I think that would be a great presentation, and I think that's something that myself as a commissioner would like to see and be in favor of having that discussion on. Everything comes with a price tag, except for what Pat Oblander can design in his office, and they do a great job, Pat, wherever you're at. But everything does have a cost, but those things that we can do that make us more effective, that get the right resources quicker, we might see an upfront cost in 911, but we'll see that savings in how those resources get allocated and making sure that we're getting the right people to the right places. And not that we're not doing a great job now, but really being more effective.
Yes, and I appreciate that, and I will get that over here to you gentlemen. So, any other questions?
Any other questions?
No, I appreciate the changes that you've been making, and seems like, based on the statistics you showed us today, it seems like things are moving in the right direction.
Okay.
These
So
are very
thank you.
positive numbers.
Yeah.
Looks good.
Okay.
I
Thank you.
wonder on burglaries if it's not down because many people are working from home too.
Well, that is a lot of it. We did notice a trend that initially, when people started staying home, the business burglaries went up. And so those have also decreased. So, yes, but that did affect a lot of those numbers as well.
Okay, well, thank you for everything you do.
Yep.
What do we have next?
Item 3, consent agenda.
I'll move that we approve the consent agenda.
Second?
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers, that total $1,068,427.47. The highest amount is our allocations, which was $400,563. And these are allocations that we do on an annual basis to our different recipients. So, for example, out of this allocation we had to the American Medical Response, AMR, our ambulance service, Catholic Charities in Northeast Kansas, Community Action for Elderly Service, Grace Med, Helping Hands, Humane Society, Pappin's Landing Senior Center, Positive Connections, the Extension Council, the Fair Association, the Medical Society, Shawnee County Regional Prevention and Soil Conservation, and the LULAC service. And again, I'm just taking a moment to look at, we do a lot of social service, a lot of outreach with our taxpayer dollars. The other expenditures on today's voucher report with our CAPERS contribution of $331,029.13, and then holding accounts with the state of Kansas was $231,334.78. Having reviewed the vouchers, I do not have any questions. We move for their approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I'll move that we approve the correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, Stormont Vale Event Center, number 1, consider approval of request to reject and rebid request for quotation for self-service ticket scanning pedestals.
Good morning, Commissioners. Kellen Seitz, Spectre Venue Management in the Stormont Vale Event Center. The request before you this morning is to reject the bid received for an RFQ request for our self-servicing and self-scanning ticket pedestals. The reason we're asking to reject this bid is we only received one bid. We did not receive a bid from the vendor that we had been working on for the project, and the bid that we did receive was considerably higher than the original estimate that we were getting on the project. All of these items here today that I'll be presenting in front of you are for our coronavirus relief funding in an effort to drive more contactless, touchless options to service our patronage at the facilities. So happy to answer any questions on this item.
Are you going to be changing the specs on this?
We are not going to be changing the specs on the RFQ. We're just going to make sure that all the entities that we've been working with do receive the RFQ to properly bid.
Okay. I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B2, consider approval of request to waive the purchasing policy for the sole source purchase of mobile food and beverage ordering systems with Bypass Mobile at a cost of $19,853, utilizing allocated coronavirus relief funds.
Good morning, Commissioners. Again, Kellen Seitz, Spectre Venue Management. This request is for, again, one of those touchless and contactless options that we're looking to introduce to the facility. This would be a mobile platform of food and beverage ordering. Patrons can order their concessions and or beverages directly from their phone or through a web device of their choosing, a tablet, a laptop if they have that there in the facility. And then their orders would be processed at the concession stands, and they would get sent a notification that their order is ready for pickup, and just go to the concession stands and pick it up. They would process all of their payment transactions on that platform and simply just have to go and pick up their items, creating less congestion, line traffic at those concession stands, as well as a smoother and easier process of your food and beverage transaction from a patron perspective.
Kellen, would there be designated pickup spots or designated concession employees just to do this?
Correct, yeah. So part of the platform is a user interface system that ties directly back into our point of sale system. Employees working in those concession stands, there would be one designated employee who processes those mobile orders, scans them in, scans them out, which directly sends a notification to the patron. The reason that this is a sole source request is because it is part of our current point of sale vendor, which is Bypass Mobile. This is an integrated service that would tie directly into that system.
Sorry. So the expense here is about $20,000. Is that an annual cost, or is that just a one-time cost that we do?
So that $19,000 would be the first year cost. That includes all of the hardware, all of the software package, and the integration into the service. There would be an additional annual cost for this, and that is something we would budget out of our operating funds for the years to come.
Commissioner
Thank
Cook.
you. Kellen, what do we see from other venues that are using this? I mean, is there an increase of sales? Is there, I mean, as we move from this, going to the traditional, I'm gonna stand in line, I get up to the concession, I make my order, and, you know, having been there for 10 or 15 minutes waiting to get my popcorn and my soda, to now I order from my seat and I just walk up and get it. I mean, do we see people purchasing more? What do we see?
So the reality is this is a very new product. It's a almost immediate rollout, just rolled out with our current vendor in October, so there's not a lot of data that shows exactly what the revenue increase to this product is, but what we do have, and the information that we do have from a patron perspective, is that it's a very well-liked platform, it's a very well-liked program. The reason being is what you just mentioned. Nobody likes waiting 20 minutes, 10 minutes in a concession line and, you know, missing part of the game or missing part of the concert or whatever it is they're there to attend. It allows them to process that order, remain seated in their seat, and then, you know, spend less than 2 to 3 minutes to go up and pick up that order and get right back to their seat. We are hoping that the ease of use of this platform does increase our profit margins, not only from a amount of transactions that we can produce and you know, shortening the queuing lines, but also from just an excitement standpoint. You know, the age of technology within our industry is rapidly changing, so being able to offer these types of services we feel is important.
Kellen, would you be able to operate with less staff with this type of?
No, not necessarily. We do have to have a dedicated person in there to receive those orders and transact them out. So reducing the amount of staff is likely not something that we're looking at. However, a lot of the staff that work in those concession stands are oftentimes volunteers, so there's not a lot of expense associated with those staff members. So even if we are looking at paid employees, I mean, the expense is minimal versus the benefit.
One more question. It seems like a lot of times when you use mobile platforms for ordering or delivery services or whatever, they increase the prices just a little bit, and then the platform takes that differential. Is that something, I mean, are they going to do that here, or is this going to be the same pricing as it would be if you walked up?
Yeah, so the beauty of this software and this system, since it's an integrated service directly into our current point of sale system, is there's no additional fees for use of this on the end user. There's no processing fees. There's no upcharge to the concession items. It would be essentially as if you were just ordering the exact same items from the concession stand.
Great, thank you.
Yeah. Any other questions?
I'd move to approve.
Second.
Motion's been made by Commissioner May, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B3, consider approval of request to waive purchasing policy for services provided through McCowan Gordon in an amount not to exceed $77,188 for COVID-19 related prevention, screening, professional medical services, and PPE utilizing allocated coronavirus relief fund funds.
Again, thank you, Commissioners. Kellen Site, Spectre Venue Management. This request is for our policy and procedural coronavirus prevention items that are part of our Spectre reopening plan. Part of that plan includes temperature screening of any patron that is on site of our facility, as well as mask mandate wearing while in the facilities and in the buildings. So where this applies is directly to McCowan Gordon's construction work that's taking place for the renovation project. These expense items are their forecasted items out over a number of months through the end of December. These are not funds and expenses that are necessarily associated with the renovation project. However, they are funds and expenses that are associated with our coronavirus prevention policies that we have in place. And the reason that we're asking for a waiver of the purchasing policy is because McCown Gordon is providing these services for all of their staff and contracting out some of these services through local medical professionals.
Any questions?
No. I'll move for approval.
Second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Opposed? Motion carries 3-0.
Thank you.
Next item.
Item C, Weed Department. Number 1, consider approval of request to award the bid to Fairbank Equipment for the purchase of 2 roadside spray units in the amount of $42,046.62, with funding from the Weed Department Capital Outlay Fund.
Good morning, Commissioners. John Landon, Weed Department. If you will recall, several weeks ago, I was before you requesting authorization to go out for bid for 2 roadside spray units. You gave permission to do that. Those bids were sent out. They were opened on September 23rd. We received 1 bid from Fairbank Equipment. After examining those bids, they meet the specifications that were outlined in the RFQ, and they come in at roughly where we thought they would be at for the price of them. And so this morning, I'm here before you asking for approval to accept those bids from Fairbank.
Mr. Chairman.
Any questions?
Mr. Chairman.
Yes.
John, I know that, we've gone to get these 2 pieces of equipment. After you purchase these, how do we stand on our equipment? I mean, you're in charge of 750,000 total parcels of land in Shawnee County.
Yes.
Where do we stand on some of our weed prevention?
This will complete half the fleet. We have 2 more trucks that are aged. The sprayers are aged as well. So I would say probably sometime next year we'll be presenting those trucks to you as well to be replaced, and then that will update the whole fleet.
Okay. And then as future needs, do you think that those are going to be able to adequately cover what you need for your department?
Yes, I do.
Okay. Any other questions?
Nope. I'll move to approve.
I'll second. Motion's been made by Commissioner Mays, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries. Thank you, John.
Thank you, Commissioners.
Next item.
Item D, Information Technology. Number 1, consider approval of request to pay invoices from B&H Photo, $10,500, Amazon, $15,200, CWD, $3,800, and Torgerson Trenching, $15,000, for the emergency purchase of equipment and services needed to allow Shawnee County Board of County Commissioners meetings to be held at the Great Overland Station for social distancing due to COVID-19.
Good morning, Commissioners. Pat O'Blind with the Information Technology Department. This item is seeking permission to pay invoices for emergency purchases for all of the equipment that we had to order in order to provision this room for audiovisual and computer and recording equipment. I do want to mention that when we got word that this needed to happen, I assigned the task to a gentleman named Mark Price, our Chief Network Engineer. And within about 2 weeks of me giving him those orders, he had designed this system, procured it, and was beginning installation within about a 2-week interval. That included all of the monitors, the cameras, the networking equipment, the audio gear, the switching gear, the antennas that were necessary to connect this building to a nearby building for internet connectivity for streaming. 2-week interval to get that done. The other thing that I told him as I was walking out the door after giving him that assignment was, also this has to be set up in a room that's multi-purpose, so everything you set up has to be capable of being torn down and set back up on a moment's notice. I got funny looks from him, but he still came through and got it all set up within about a 2-week interval, which was quite amazing. So I did want to give him a shout out for getting this all pulled together so quickly and so well provisioned. With that, I would ask if you have any questions. I'd be happy to answer those.
This $42,000, this will be paid for through CARES Act funding?
Yes. This is all due to social distancing requirements and having to move from the commission chambers to this larger venue to accommodate those social distancing requirements. So this would be covered by the CARES Act funding that's been sent to the county from the state of Kansas for
And
CARES
we
Act
can meet
funding.
the deadline, our timeline for construction here?
Yes, yeah, we've definitely expended the funds, and we've definitely beat the December 30th deadline for getting those expended and built.
Any question? Yes.
Just to kind of expand on what you said about Mark's work also, is that he's been working to adapt as well. So the first couple meetings, people said the audio quality was bad, so he fixed that.
Yep.
And then we also had the JADO meeting at the Stormont Vale Event Center, and he packed all this stuff up and moved it over there and then moved it back that night. I mean, it was, he's gone above and beyond to make this thing work out.
I'd have to agree.
Yeah.
Yeah, that's what I was going to say, is just the work that he does, and it's very much appreciated, and being able to accommodate and adapt, and the JADO meeting, being able to pack up everything, move it over, and we're indebted to him for that. So I'll make a motion to approve the expenditures.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Pat, and
Thank you,
thanks.
Commissioners.
Tell Mark thanks.
I will.
Next item.
Item E, Parks and Recreation. Number 1, consider authorization and execution of Contract C 383-2020, a 5-year agreement with Axon International to be the sole source provider for 5 body cameras, docking stations, evidence.com storage, and related operating miscellaneous equipment at a cost of $18,570 the first year and $5,856 for each of the remaining 4 years.
Good morning, Commissioners. Randy Luby, Parks and Recreation. Before you today, we're asking your approval for sole source and execute the agreement with Axon International. Our Sheriff's Department uses this vendor as well as the DA's office. We've checked with Betty Griner. She approves this purchase. And we've made connections with Pat Oglander in IT for the storage of the evidence on this also. The benefits of this obviously is strengthens our police accountability, as well as providing critical videos for investigations and stuff. I do have Chief Cope here if you would have any questions for this request.
Mr. Chairman.
Yes.
Randy, when we were looking at the purchase, were we getting the same price that the Shawnee County Sheriff's got? Or is there a discount if we would have purchased it through the sheriff's contract?
Actually, I believe Mike said we were getting a better price than the Sheriff's Department, I believe. Yes, Mike, if you want to come up.
Morning, Commissioners. Mike Cope, our Police Chief. As Brandy says, we did check with the Sheriff's Department about partnering, doing a partnership with them, and they had a 3-year contract set up for us at $38,000, a little over $38,000, versus a 5-year contract, and we're getting some more equipment. We're having our own evidence storage. We're having our own redaction programs. We're getting our own training based on that. So I think overall of our 5-year contract versus a 3-year contract, I think we're getting an overall better deal.
So by having it on a 5-year basis as opposed to a 3, they were able to reduce some of the cost.
I believe so.
Any other questions?
No, I'll move to approve. Go ahead.
I guess I have one question. How many staff do you have that'll be wearing these?
I currently have 3 full-timers and currently 1 part-timer, but I'm got applications to fill some more part-time slots to fill vacancies in our busy time during the summertime, so.
Okay, all right. I will second. I think you made the motion.
Yep, I did.
Motion's made by Commissioner May, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0.
Thank you, Commissioners.
Thank you. Cope. Randy, thank you. Next item.
Item E2, consider authorization and execution of Contract C 384-2020 with Otis Elevator Company through December 31, 2021 to continue elevator maintenance service at the Great Overland Station at a monthly cost of $136.66 with funding from the department operating budget.
Good morning, Commissioners. John Boyd, Parks and Recreation. We are seeking your permission to assign this contract that Railroad Heritage, Inc. had already had established for the maintenance of the elevator for this building, and we would just like to go ahead and carry that contract out to its conclusion.
John, we have a number of elevators. Do we have a different contract then for all the rest of them, or is this something that can be included with existing contracts? Or is this...
We have a separate contract for our other elevators. This, from what I understand, this contract had a termination penalty or a clause that we would have to pay.
Even though we're different owners? Is that, Jim, is that what you understand?
Jim Kraus, Shawnee County Councilor. Yes, we were successors under that same contract, so we would be obligated until that contract runs its course.
And when would this contract end then?
December 2021.
21, okay. Maybe at that point, we look at bundling all of them together. We might be at cost savings at that point.
It would definitely be good to bring Bill Kroll, facilities manager, into it. We have several elevators across the county and issues with them, and we're always, seems like we're jockeying with elevator companies on repair and maintenance.
All right, thank you.
I'll move to approve.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, John. Next item.
Item E3, consider authorization and execution of contract C385-2020 with Power Play IT Barrington, Inc. for the sole source purchase of playground replacement parts for the damage that occurred on August 11th at a total cost of $14,997.46 with funding from the department operating budget.
Morning, Commissioners. Jeremy Myers, Parks and Recreation. I'm here requesting your approval for the repair and replacement of some parts that were damaged on our playground over at Betty Phillips Park. If you have any questions, I'd be happy to answer.
Was this vandalism? Is that what we?
It was a car accident onto the playground.
Okay, a car accident.
Mr. Chairman. Mr. Chairman.
Yes.
Does our insurance coverage, I mean, we're looking at $14,997.46. I think that, Ms. Beck, we had a deductible on our equipment. Isn't it at $10,000?
I did not. I know we seeked restitution through the DA's office for this piece.
I don't think we had a claim filed, but we do, we do have a, this would be covered under our, what we call inland marine property, and I think we have a $10,000 deductible.
Yeah, because we have a $10,000 deductible, so we might want to use our insurance policy to cover it.
Yeah, we can find out.
Good to know.
If we just, all we need is the police report, and we can, and the date of the information, and send it to John Morgan in my office.
We'll do that.
We'll take care of that, sure.
Ms. Beck, should we delay action then on approving this before we submit it to claim?
Well, they're gonna have to do it anyway, and then it would just be a reimbursement through the, if it gets approved, the insurance company, they would get they'd still have to pay the $10,000, and then the $4,000 would be reimbursed to them.
I mean, at least then we're saving the county $5,000.
Right, yeah, so it's just a matter, like I said, matter of, obviously, they want the playground equipment, so it's up to you.
Jennifer Sauer, our audit finance. Typically what happens is this gets approved and we make the payment, and then after we receive the money back from the insurance company, we do a journal entry to move the money to the appropriate funding.
Okay.
Are we pursuing getting money from the person who ran into our play structure? I mean, I presume the play structure was not at fault.
No, it was not. But we did apply for the restitution with the DA's office.
Okay.
So is it safe to assume they were uninsured then? I do not know. I know Mike Cope with the Park Police took that report, so I believe.
Good morning, Commissioners. Mike Cope, Park Police Chief. This was an accident involved with a chase with the Highway Patrol. The vehicle went off into the playground equipment and caused damage after the chase had occurred. It was a stolen vehicle, so We don't have insurance. The person's not going to be responsible that owned the car because it was a criminal act, more than likely. So that's why I reached out to DA's office. They did not have us listed as victims. I asked them if they would add Shawnee County as victims for the loss of the playground equipment, especially without the thoughts of having insurance. I did talk to John Morgan. He was not sure about what we had for insurance at the time, so that'll be something we'll definitely follow up on. But yeah, chances of getting it from insurance, not a chance that I can see, but again, we're gonna try to get restitution from the person involved.
Well, and one thing is if there is anything, if our insurance company pays for it, they will actually, they'll
Pursue it.
research it. If there's anything they can get, then they can get money back. That's up to our insurance company to do that.
Okay.
So we'll contact them, make sure, see if there's something to be gotten.
I'll make a motion to approve the expenditure, but also just asking that our department follow up with the insurance carriers, and so that we see if we can have it covered by our insurance through the county.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0.
Thank you, Commissioners.
Thank you, Jeremy. Next item.
Item F, Public Works. Number 1, consider authorization and execution of contract C 386-2020 with SBB Engineering to prepare bidding plans and documents, conduct geological investigation, and provide construction engineering, including surveying services as necessary for the construction of the Northwest 49th Terrace in the Green Hill Point subdivision at a cost of $26,200 for design services and $31,000 for construction engineering services, with funding from Shawnee County bonds to be repaid by the owners within the benefit district.
Good morning, Jeff Hunt, Deputy Director of Public Works. I flashed up the general location of this subdivision. It's located approximately at Northwest 50th and Green Hills Road. In the description there, you can see the cul-de-sac bulb coming off of Green Hills Road. That's what we're talking. That's the design of this project that we're talking about. This contract before you today is a professional services contract. It's to create bidding documents, a geological survey, construction engineering during the project when it's actually being constructed, and for the survey when it's actually being constructed. This is a continuation of the project budget and resolution that was approved on July 9th of this year. The developer has paid the financial security for this project. The sanitary sewer and water line projects, we're currently getting going on those. They are developer projects. The developer is paying for those with other sources. The plan for this project is to get this project approved as quickly as possible and get it started just as soon after the sewer and the water line construction is complete. This project should be completed next summer without any complications. And with that, I'd stand for some questions.
Do you have any questions?
Mr. Chairman?
Yes.
I just might point out that this appears that at the end, we're going to have 18 lots that this would be addressing. Is that correct?
That is correct.
And so these are costs that are going to be paid by the owner. Are they recouped when they sell these 18 lots or develop them?
Well, once the developer sells the lots, the owner of the lots would be on the hook for the benefit for paying the special assessments at property tax time.
Okay.
So whoever owns those lots, when the tax bill goes out, would be responsible for paying them until he sells them.
And I just want to make sure that, it's my understanding that we've had some issues in past where we have these benefit districts. If the owner was to not pay their taxes and it was to go to sale at a foreclosure sale through the county counselor's office, that the county actually winds up taking on these costs and assuming them because the new owner does not have to. And maybe Mr. Corral can explain. Because I think that, we always talk about passing the cost off to the owner, but the county could be liable.
Good morning, Commissioners. Again, Jim Krause, Shawnee County Counselor. We do have surety requirements that the developer has met to cover us in the eventuality that we would have an economic downturn, the development not be successful. Otherwise, to your question about tax foreclosure sales, when we do a foreclosure sale on a piece of property, all taxes, general and special taxes that are due up to that date of the sale are removed. Future specials, and specials are generally laid out over a 10 to 20 year period. Future ones that have not yet come due remain attached to the property and will be due by the new owner who purchased it in the tax sale, but past due taxes would be removed. I hope that answers your
So
question.
just to make sure that we're clear, if Kurt Niehaus had a piece of property that was acquired through a tax foreclosure, and there was $10,000 that was due, that $10,000 does not pass on to Commissioner Mays when he buys the property.
No, those are wiped out. The only thing that he would get would be any general tax assessments going forward and any unpaid specials that were yet to come due.
Well, hopefully these are sold quickly and we have 18 new lots and adding more value and more residents to Shawnee County.
Are these specials usually 20 years? Is that?
Yes. That's pretty typical.
Just,
Commissioner Mays.
Jim, just to clarify also, if we were to take these back in a tax auction and auction them off, I mean, the sale price from the auction works to pay down the tax.
Exactly.
Yeah.
Yeah, the taxes are gonna be removed, hopefully, and for lots like this, typically, the purchase price is gonna be enough to cover past due. Now, there are situations we've had in the community and in other communities when the 2008 recession hit, where that was such a downturn and the specials were high enough, it has rendered some new lots unmarketable, and they sit in a sort of a financial limbo
Yeah.
of what to do with them.
Mr. Chairman, I do have one other question. I see that this is a joint project with the city of Topeka, and is that because it falls within the 3-mile radius?
Well, the joint project would just be the sanitary sewer.
And is that connecting into the Half-Day Creek interceptor?
That is correct.
And so in the past, the city of Topeka has been resistive to the county adding more lots or lot development through the planning department, the city planning. Are we anticipating any problems or difficulties?
No, this is the approved plat. The plat has been approved, and then this plan has been approved by the city of Topeka.
Okay. I'll make a motion to approve.
All approve, or second? Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Jeff. Next item.
Item G, elections. Number 1, consider approval of sole source purchase of election systems and software, Inc. for the purchase of a DS-450 high-speed ballot tabulator to include installation and training at a cost of $55,825, utilizing COVID grant funds, and authorization and execution of contract C-387-2020 for same.
Morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. What you have before you is a request to purchase a high-speed ballot tabulator. As you know, we have a record number of mail ballots to process, and it's going to take some time to do that. So we're requesting purchase this with COVID funds. I would be happy to answer any additional questions you may have about that.
Any questions?
Mr. Chairman?
Yes.
See, Mr. Mays.
Andrew, is the acquisition of this type of thing going to positively affect the way you do elections moving past this election cycle? I mean, is this something that's going to last for 10, 20 years and it'll increase the efficiencies, or?
Yeah, I do expect it will increase efficiencies. One of the things that's kind of interesting about the law that has changed in the last couple of years, we actually have mail ballots now that we can receive. They have to be postmarked on that election day, but we can receive them through Friday, and we really don't know how many we're going to receive after Election Day. And as long as they're received by Friday but still postmarked on that Election Day, I think there's a chance we may receive a number of those in there too. So I think it will help with efficiencies. It will help for some of those processes now that can extend a little bit longer. But also, I think we also need to be careful that we're making sure that we're getting this done timely, because part of the challenge in elections is keeping public confidence that we're not taking forever to actually tabulate ballots. So It helps efficiency, it helps on speed, it helps us get that done and get it quickly and efficiently at the same time. And I do expect at least another 10 years of use out of it with no problem.
Mr. Cook?
Oh, go ahead, Mr. Tremaine, I think you saw.
Well, I just have one more question about, I mean, is there any reason to question the accuracy of these tabulators? I mean, are they going to kick out irregular ballots or anything like that for provisionals or anything like that?
No, we actually have done pretty extensive testing on all these tabulators internally. In fact, we do public tests every year. The public is welcome to come and view those and to kind of check out how it works. They're very accurate. On occasion, it will kick a ballot out, but it won't make it provisional. It will just have a question mark. For instance, if someone puts a pin mark in some area they really shouldn't have, that will additionally be reviewed. But that's really a pretty standard practice to make sure that you're actually divining, and it's not me that does it, it's boards of Democrats and Republicans who are appointed to do that. And they're just reviewing for accuracy to make sure that the voter intent, it's a voter intent state, we're just trying to make sure that the voter intent is accurately followed.
Okay, great, thank you.
Good. Any other questions?
Yes, thank you, Mr. Chairman. Andrew, over the last 4 years, and actually probably over the last 8, we see a change in how people are voting. We see an increase of advanced voters in person. We see now the increase this year. It seems like there's a lot more discussion about advanced vote by mail. What is your office seeing? And I guess start with, when is the last time I can still sign up to advanced vote by mail, or when can I come into your office and start voting?
You could come to vote at the election office on the 19th internally at the office. There's going to be 2 weeks of voting at the office. You can request a mail ballot at any time, right up, I believe the 27th is the last day to get that request document to us, but we're going to be mailing ballots out on the 14th if you've already got an application in, but there's still plenty of time beyond that to fill out an application and get it to us, clear up through the 27th. And then if for some reason you can't get an application to us, you know, we still have ways to help you make sure you can come in and vote in the office. You can always stop by, you can call. There's still plenty of time to get it done. I think the bigger date to pay attention to at the moment is the 13th is the last day to register, and there's always a large number of people who haven't gotten registered that vote, and then the provisional process kicks in, and then under state law, there's no way for those to count. So I would encourage people to look at the 13th deadline, make sure you're registered by then. But the 13th and the 19th, you know, voting in the office, and then you have plenty of time yet to go ahead and request a mail ballot as well.
So I should start looking for advanced ballots between the 19th or 17th, somewhere in that range.
Yeah, we're mailing them out on the 14th. If you've already got your application in, we've received it, we'll be mailing out everything that we have. Over 20,000 will be mailed out on the 14th. Yeah, 16th to 17th would be somewhere between there, I would guess would be the date that we would expect people to begin receiving those ballots in the mail.
Now, how does 2020 compare so far to 2016? What were the total amount of advanced ballots we did by mail?
I think we're right at 8,000 ballots by mail in 2016, and we know that we're over 20,000 now, so it's a pretty significant jump.
That's almost a more than double increase.
Correct, yeah, and we still have yet to go some requests yet that we know are going to be processed.
And then ultimately, as we look at that, would you start seeing maybe in the next 4 years changing how your office handles elections? If we continue to see this trend of voting in person and advance mail, I mean, I think that at some point, doesn't your office look at our precincts and looking at how people vote?
We'll certainly look at it. We're always trying to analyze, you know, where the trends are going. I don't think any of us know where COVID is going to take us, how long that's going to last, so I don't want to jump too far out in front. I think a lot of the mail requests are related directly to the COVID issue and people not wanting to have a lot of public contact, and I understand that, so we'll certainly look at it. I still think voting in the office, which has been growing pretty rapidly, will be significant this time. This is probably the single biggest challenge in the office, is figuring out how to allocate resources for this election, because it's always a challenge making sure you have enough people at the polling place, but also making sure you have enough people to process those ballots internally for those mail ballots, as well as staffing up correctly for what you anticipate. So it's It's been a challenge this year to try to anticipate where people are going to go to vote. We certainly know mail's up, so that means something else will probably be down some.
Andrew, how many extra staff do you have to have on hand for all these mail-in ballots? This has got to cost us a lot of money for...
Yeah, I don't think we really know for sure what the total expense will be. I think we're fortunate in some ways that COVID grant funding will help us pay for the excess cost, I believe, this year. Going forward, there will be a question mark, I think, about the additional cost of that. It's pretty significant. We're trying to build some efficiencies into our processes for mail with these two requests today. We're trying to build efficiencies, and I actually would argue additional accuracy as well with the scanner that we'll talk about here in a minute. But there is an additional cost. I don't think we know for sure yet what that will actually end up being, but we plan to pay that excess cost for this budget year out of grant funds.
So when a mail-in ballot comes into your office, so are they just scanned then, or is it a process where you have to manually?
There is a large set of issues that we check for accuracy. Is the address on the application correct? Is the person registered? Does their signature match what we have on file? And then it has to be scanned into a database. We keep a record of it for every voter in case there's a question at some point. We've got that readily available. And then at the end of the night, we actually go back and check and make sure that every request that came to us, that the numbers match. So there's a lot of additional just accuracy checking to make sure that each and every application that we know we actually got into the system. So it takes a lot of accounting. And then, of course, someone has to actually pull each of those ballots, make sure they get in the right envelope. And with 213 different ballot styles, you can't just start putting any ballot into any envelope. So there's a lot of accuracy and processing time and double checks on that system to make sure that we're getting the correct ballot to the correct person.
And then, of course, we have to make sure they don't come in and vote after they've mailed in.
Yes, we're always monitoring on election day as well as early voting to make sure that only one vote has been cast. So there's additional time for that, of course.
Yes.
Are you still needing election workers?
We are. I think the bigger challenge for us isn't so much election workers at the moment. It's election workers with experience. I think we're down 150 people with experience. So, and we've had a lot of new people request to work. So we're trying to work through that, but we need to balance the new workers with the number of workers with experience. So I think that's the biggest challenge at the moment, is getting those numbers to where we're comfortable. We've done the best that we can to make sure we have plenty of experience on each board.
Okay, thank you.
Are we all set on our polling places and everything's?
We are.
Good.
Yeah, I think we have 94 polling places, just like we did in the primary. We always have to move one or two due to things that we can't really do much about. So minor changes, but very similar to what you saw in the primary, and of course by law. And we've always anytime there's a change in a polling place, we send out a postcard to every voter at least 30 days in advance if possible. So we've tried to communicate with voters about that. And of course, the mailing the county did earlier this year was also an attempt to make sure that people could keep track of all those processes more easily, get to their applications, check their status, check their registration, check their polling place, check their sample ballot. So I would encourage people to use that website that we sent you the mailer on, because I think it's helpful. If there are minor changes, is another way for voters to verify, where they're at, what their status is, and if any changes occur.
Okay. All right. I will move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item G2, consider approval of request for an emergency purchase with Information Management and Securities, LLC, for the purchase of a KV-S8127 Panasonic color scanner, including accessories and software, at a cost of $37,781.70, utilizing COVID grant funds, and authorization and execution of contract C388-2020 for same.
Good morning, Commissioners. Again, this is what we talked about a little bit earlier. We believe that this scanner will help us do a better job of assessing signatures, and we'll do it quicker. Each signature on each ballot will be assigned an accuracy score for its comparison. I think actually having a machine helping us do a signature verification match will give us the tools to know where to focus staff time. So if we've got a 99.5% accuracy assumption on 50% of ballots, we will not spend as much time on the accuracy of those signatures. So it helps us be more efficient, get them processed and scanned quicker with a high-speed scanner, but also helps on letting us know where to focus our time and effort on making sure those signatures match. I'd be happy to answer any other questions.
Questions?
I'll move for approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Andrew.
Thanks.
Next item.
Item 5, Administrative Communications.
Okay. At this time, we'll allow anybody from the public to speak on any subject, or somebody from one of our departments would like to speak on anything. All right. Dr. Petzino, did you want to speak a little bit about the latest scorecard?
Good morning, Commissioners. Gianfranco Pezzino, Shawnee County Health Officer, and thank you for inviting me to give you a quick update on our most recent trends in the county for coronavirus. We are going to release our weekly scorecard just later today, and I'm going to give you a quick overview of some of the trends we have observed. As you probably remember, in the scorecard, we track 6 different measures of infection, and we also have an overall score, an index score as we call it, that gives an overall summary of the trends in the previous, actually for most measures in the previous 2 weeks, because we take the average of those values for the previous 2 weeks. In the scorecard that we are going to release today, out of those 6 indicators, none of those improved, and some of them worsened and some others remained the same. For the 3rd week in a row, we are finding a number of cases that is going up. And as a result, our index score, so the summary score that we have that combines the experience from all the 6 indicators, is going to move from yellow to orange. The yellow and orange, the colors represent different zones of transmission, with green being the most favorable and red being the least favorable. Last week we were on yellow, and this week we will be on orange. The positivity rate, so the percentage of tests done that are positive, has also gone up, but not very much, and we are still below the 5% mark, which is really a good threshold. We start worrying when we are going above the 5%. One thing that concerns us is still the percentage of cases for which we do not know where they acquired their infection. That number has gone up again this week, and it was already pretty high in the previous weeks. We don't know exactly why that is, but we strongly suspect it's a combination of different factors. We definitely have an increase in the number of people who just do not want to disclose information, and that's unfortunate, because that's really not helping us doing the job that we are supposed to do in containing the spread of the disease. But that is not the only factor. Also, for those that do provide information, we often are not able to pinpoint likely sources for the infection, and we think that what's happening here is that we just see more virus being spread in the community and more people being infected without really, honestly, not knowing where they acquired that infection. And in many cases, that infection is possibly the result of exposure in small or larger groups of people that congregate privately in a private setting. So as you know, we have a limit to the size of mass gatherings in Shawnee County. But you know what people do in the private environment of their homes, it's really something that is very hard to control, and we probably wouldn't even want to control them much because that's, you know, their private home. And we have seen cases of, you know, small or larger parties taking place, and even though those parties should be subject to the limit of mass gatherings, which for indoors mass gatherings in Shawnee County right now is 25, sometimes people go above the limit. We have seen family reunions taking place, and those sometimes exceed the limit that has been established. Just yesterday, we were reviewing a cluster of cases that was the result of a weekend spent on a lake outside of our state. And, you know, people like to have fun. I can blame them, but that's the result. Now we have multiple cases related to that event. So that's also an appeal to our public to really take these measures that are in place seriously. And one of the very predictable ways to transmit the virus is by congregating with other people, especially in an indoor setting. It's not by chance, I think, that we are seeing this increase a few weeks after Labor Day, which traditionally is a time when people tend to congregate and have a good time in relatively large groups. With the holiday season coming up, with Thanksgiving coming up, that's definitely a reason for concern. In terms of age distribution, which is not shown on the scorecard at this time, we have seen a slight shift from younger and older ages towards the middle age group. So essentially, most cases that we see now are middle-aged adults, and we still have a few cases from nursing homes, but not as many as a few weeks ago. Hospitalizations remain low, but they are increasing. They definitely are increasing, and the information that we have from our two hospitals as recently as a couple of days, and even this morning actually, shows that their experience overall is worsening. Dr. Kenegi from Stormont Vale Health shared some information yesterday saying that over the past couple of days, we experienced an increased utilization of our call before you go line. That's the phone line that people call before they go to an express care site to be seen. And we have seen a steady number of visits to the Cotton O'Neill Respiratory Clinic. Calls were at 390 Monday and 276 on Tuesday. So those are pretty high numbers, just especially for you know, just one weekday. Bed occupancy rates are also going up. They have gone up for the past several days in both hospitals. And Stormont Vale is now at, I believe, I saw the card today, 87%, if I'm not mistaken. So those are really high numbers. Once you start reaching the 85 plus, you really don't have a lot of margin to accommodate additional patients. Now, I want to be clear, these are not COVID-19 patients. We did see a number of hospitalizations for COVID also increasing, and right now I believe we are at about 32 current hospitalizations for COVID. But what that does, the overall hospitalization, it does put a stress on the system, and you know, given the fact that we are going into the influenza season, that's definitely something we need to monitor. On a positive note, we have not seen any major problem in schools. And that's really something that we are very pleased with. As many of you know, we have worked with schools very diligently for months before the reopening date was scheduled to happen. Schools have been absolutely receptive to our advice, and we still have weekly calls that gather, you know, a couple of dozen people with many superintendents themselves, making a point of being there and then discussing with other superintendents their experience and with us and getting our advice. So we have seen cases in schools, both in staff and in children, but those cases by far and large, almost invariably, are the result of infections acquired in the community. not in the school. As a matter of fact, we haven't documented a single case of transmission within the classroom setting at this point. So that's good news. It means that the measures that schools have put in place are working. Couple of words of caution around these numbers. Schools are back in session, but many schools are still following a hybrid model, so the amount of classroom time that they have face-to-face is still being limited so far. So we need to watch and monitor what's going on once they come back for face-to-face teaching 5 days a week, which many schools are planning to do in the upcoming days. The other thing is that athletic activities remain an issue. And several of the cases that we have seen, at least in a couple of instances, that were the results of what we suspect was transmission within an athletic team. And what happens for some athletic sports, for some sports that are considered as high risk and moderate risk, if a member of the team is positive, most of the time, the entire team is going to be placed on quarantine, just because there is no way to distinguish who had really close contact with whom. They're just playing as a team together, having physical contact, breathing very hard on each other, and those are all risk factors that have been demonstrated to be to increase the risk of transmission. So in summary, there are some good news. The schools are one of them, but the trends overall are something that we are watching and are a reason for concern for me. We are not approaching the red zone. We are not approaching the uncontrolled level. But if these trends continue for a few more weeks, we may very well end up on that red zone, and we really do not want to do that. We were there for a week back in August, and we decided to take additional precautions, which seem to have worked, at least in part, to bring those numbers down. That's about a scorecard, so let me pause and see what questions you might have about that.
Okay. On your scorecard, I noticed we never tell on there what the hospitalization rate is for age groups, or we never tell what the death rate is. Is that not important?
That is important. It's not something that is reflected in the scorecard, but it's something that we have on our dashboard. We have a dashboard that's updated, at least currently, it's updated daily, and that's where we have the current hospitalizations, the number of active cases, the number of people that come out of isolation, so essentially they are through the acute phase, and they are no longer considered infectious. So we have all those numbers there, and we also have the number of deaths there. So all that information is available. Then KDHE has a separate site where they have age breakdowns, which is very detailed, and we are working to include those age breakdown numbers also on our dashboard. So those numbers are available. They're not all of them are necessarily included in the scorecard.
You said that the increase in cases is what age group now? What's the main age? Is it? You say it's not the young. It's not school
Most of the
kids.
cases right now that we are seeing are in the middle age group, as I would call them. So let's say between 35 and 55 and 60.
And they have a very low hospitalization rate, right?
Yes.
Yeah.
Yes.
What is the overall recovery rate or hospitalization rate in Shawnee County? Do you know?
Well, right now, out of almost 3,000 cases that we have, more than 2,500 have come out of their acute period. So that represents about 87% of all the total cases. The remaining cases are either current active cases or they are cases that were deceased.
I don't know if you understand what I'm saying. What are your chances of being hospitalized if you get COVID-19?
It's difficult to calculate the chance, but you can do some math. We had currently we have 32 cases hospitalized. I don't have the total number of hospitalizations with me overall since the beginning. That number has gone down progressively. The better people become or healthcare providers become at treating patients. So it's definitely not a disease that will bring everybody to the hospital. And in fact, the more we learn about this disease, the more we know that many people who are infected do not even exhibit any symptoms.
I was
but
using,
they can infect other people, and some people do become sick. So, it's like playing the lottery a little bit. Sometimes you win, and many
It's the
times you
lottery.
lose.
I was using CDC's numbers from September 26th. And of course, they have numbers per 100,000. And I just used our county population numbers and things. And it said no matter what age, if you're confirmed to have COVID-19, your chance of being hospitalized are less than 1%, no matter your age.
I don't doubt that.
That's pretty low.
I don't doubt that.
In
I
fact-
also think that looking at hospitalization rate as the main indicator of the severity of the disease is misguided. I think this disease has many other aspects that should make us worry besides the hospitalization rate.
Yeah.
Mr. Chairman?
Yes.
As you mentioned, Doctor, that we are learning more, and as a novel virus, it's brand new. Some of the news reports are indicating that your blood type may have an indicator. What are some of the things that we're seeing on a local level that we're now knowing more than we did maybe in May?
Well, some of these things that we read in news reports are really cutting edge type of findings, so they haven't really made it yet into the mainstream of public health intervention. They haven't been translated into public health intervention. So typically what we do in Shawnee County and in the rest of the state, we follow what the CDC and the State Department of Health and Environment advise us to do, and we try to adapt those recommendations to our local situation. Certainly do that, but by far and large, we don't depart too much from what most public health experts will recommend. In terms of what we have learned a lot. We have learned that this is not a death sentence, that not many people die, but unfortunately many do die, and I want to talk about that in a moment. We also learned that there are many more people infected than those that are recognized, so the most reliable estimate that I've seen recently is that probably there are about 10 times as many people infected as the number of diagnosed cases. And we learned that good treatment can actually many times keep people out of the hospitals, and even if they are hospitalized, can keep people out of ventilators and intensive care units. So there is a lot that has changed since March, especially for a totally brand new virus, as you said.
So you mentioned hospitals, and we were talking just a moment ago with Commissioner Rippon about hospitalized and who goes to what hospital. There was a release, I believe, yesterday or the day before from our media partner talking about reaching an 88% capacity in a hospital. How does the health department and yourself as the health officer work with the hospitals on their capacities?
We are in constant contact with them. Of course, we don't have any way to increase our capacity, of course, but we do monitor the situation with them. And we have weekly calls with our hospitals, and we are also planning an event that will involve all the providers in the county, so all the doctors and primary care providers in the county, to discuss the challenges that are posed with the seasonal influenza season being around the corner and how we can address those challenges. So our role is primarily one on convening those conversations, identifying the gaps, and trying to foster collaborations among the different partners involved.
If we reach a point of maximum capacity in a hospital, are we able to use a regional model to have people go to other hospitals that maybe be outside of Topeka or Shawnee County to be able to have medical care?
Yes, we are. And again, that's not something that the health department is in charge of, but each of the two hospitals have contingency plans that they will use in a case like that. They also have what we call modified standards of care. So if the situation gets really very heavy, they will triage essentially patients and see which patients could be transferred to other institutions and which patients need to remain in their institution, receive intensive care unit, for example. So those plans are all in place. We are not near that capacity crisis, but we definitely want to, as usually, plan for the worst and hope for the best.
You mentioned the, sorry. Go ahead. You mentioned the Kansas Department of Health and Environment and looking at their dashboards. Why, there's sometimes a difference between what the Kansas Department of Health and Environment is reporting and what we're reporting? Are we looking at the same data? Are they looking at different data? Are they receiving it from different sources? Why might there be a difference sometimes between those two dashboards?
There are a few reasons for those differences, and believe me, as an epidemiologist, those differences drive me crazy. So when I see a difference even by one unit, I may spend hours trying to understand why that one case was not counted here or there. But putting that aside, we try our best to use data from the State Department of Health and Environment for several reasons, one of which is consistency, because we like to have consistency. We think that having different numbers that try to measure the same element is very confusing for everybody. And the other is that they have good staff. You know, they have good epidemiologists. They have data from all over the state, and they do this. They have people that do that all day long, as opposed to that being just one of the many tasks that our staff have to conduct. So we try to do that. But number one, those numbers change because those are live numbers. So for example, when we go on a Monday morning to the KDHE website and we look back at how many cases they report for Shawnee County for the previous week, that number of cases may be, say, 99. And actually, this is a real example from a couple of weeks ago. When we check the same week, 3 days later, the number of cases may have increased to 125. And it's not because the 99 was wrong, it's because the information was still incomplete. So since we have such a fluid situation, sometimes that accounts for those differences. And finally, the other thing is that not all the data that we want to count and publish is available on the KDHE side. So sometimes we need to depart a little bit from that.
Thank you.
They haven't always been the pillar of accuracy, and in fact, they've almost been deceitful a couple times, and so it kind of makes me a little leery of the numbers, and not only the number discrepancy drive you nuts, they drive us nuts as well. When you said the hospitals had 87% capacity, is that total capacity for the whole hospital, or is that just the beds they have designated for COVID patients?
No, that's total capacity.
Full capacity.
For medical and surgery.
And
yeah,
have we come close to even tapping out their resources? Have we come close to?
No,
Okay.
we haven't. I think 87 may be just about as high as it has been. I think a few times back in March we were close to 90 perhaps.
And has anybody in the country tapped out their hospitals?
Oh, absolutely.
I know in New York,
that has happened multiple times in especially large cities like New York.
I know in New York, even at their worst moment, didn't use all the mobile hospitals they brought in and the ship that they brought in. They didn't even use those.
Well, New York exceeded their capacity multiple times, Commissioner, and so did other places like Houston, for example, was one of them, and not long ago. So those things are real, and you know, when you see refrigerated trucks outside of a hospital to store, you know, dead bodies because their morgue is full, something is going on in that hospital, and those were scenes that are quite common in New York City.
You know,
but that hasn't happened here in Topeka yet.
No, and it
Absolutely
hasn't happened
not.
in
No,
99%
not even
of
close to
places, actually. You know, with a hospitalization rate of being less than 1%, if you get this, well, just an example, if using the CDC's numbers, if every kid in Shawnee County got the virus tomorrow, it would amount to maybe 3 hospitalizations. And of course, that's not going to happen. But that's every kid if it happened right away. So I don't think we're in any danger of overrunning our hospitals, especially with our schools opening up.
Commissioner, excuse me if I interrupt, what your statement is missing is the fact that those kids will infect other people, who then will infect other people, who then will infect other people.
That's a good point. They will, and it's probably their parents. And their parents
their
would probably be
grandparents.
in the range of 30 to 39, 40. Still, even they have a 99.88 chance of being hospitalized if you're from 30 to 39. If you're from 40 to 49, your chance of being hospitalized is 99.82, a chance of not being hospitalized. If their grandparents get it, if you're 65, your chances of not being hospitalized is 99.52. These are incredibly low numbers. How much lower would they have to get where we could?
Here is the reality, Commissioner. COVID-19 in the United States has killed over 200,000 people already. By the end of the year, all the projections show that we'll end up being the third most common cause of death in the United States, only after heart disease and cancer. I think everybody in this room probably will agree that cancer is a serious public health problem. Do you know how many cases of cancer do we have in the United States every year? About 1.7 million. That accounts for 0.005% of the entire population of the United States being affected by cancer. And yet it's the first cause of death in the United States. And we spend billions and billions of dollars trying to fight cancer. Same thing for heart disease, same thing for the seasonal influenza that many people want to compare COVID to. We spend a lot of money and resources trying to contain those numbers, and yet they're still problems. So I'm not sure why we would treat something like COVID-19 in a different way. When I say that cancer only affects 0.005%, I'm not trying to diminish the importance of cancer. But in Shawnee County already, if you just count the number of confirmed cases, which is almost 3,000, and you calculate that rate for the population, that's about 17%. That's about, let's see, that would be, about 17% if I do my math. 1.7% of the entire population, 1.7%.
Yeah.
My point being, so that's many times more, what we have for cancer. So my point being, I'm trying to keep this threat under control. I want to keep it checked. I want not to overblow it out of proportion, but I also want people to respect this threat. Because the more confusing the message that we sent out, the more we talked about the fact that, most people will recover anyway, the more confusing and harder it's going to be for people to control this, and we need to control it.
We do spend billions of dollars on cancer. We spent trillions on this one, trillions. And we've killed our economy in a lot of ways. There's a lot of businesses that won't recover. We're hearing about them every day. For a virus that's 99.9% recoverable. I don't know when in the history of this country we've ever reacted that much to a virus. And sure, it may be the third largest killer, but at what cost? And how many people will die from collateral damage? The people that stay home, the suicides, the people who aren't going in and getting their cancer treatment. What are we doing for those people?
Mr. Chairman, at this point, I think the question has, unless you've got a DeLorean in the parking lot, which, if you do, I've got a couple moments in my life I'd like to do different. We look at where we're at today and how we move forward. And so we take the information and data that we have, and that's why we have Dr. Pizzino here, to take the information that we have now moving forward. We have our schools opening up. We have some in hybrid models, some in full models. Businesses, we've addressed businesses and how we open up our businesses. We address the restaurants, bars, and I think that I'm curious to hear from Dr. Pizzino, because it was just 2 weeks ago we were talking about looking at our trends and where we're at, if we're going to be making any changes to our health orders, and I'm hopeful that that's where you were going with your line of questions is, are we going to be looking at, when do we start looking at any changes to our health orders? Are there going to be any major changes? And I think that's the question I get asked the most from the public is, when can we anticipate changes and what needs to happen? And I think that in the past we've talked about transmission rate. So, Doctor?
Sure. Our plan is to start lifting some of the precautions that are currently in place in Shawnee County. Once we can go through 2 weeks in the yellow zone and see trends that are not worsening from week to week. We were very close. Last week actually was the second week we were in the yellow zone. The reason we did not act is because, number one, we were in the yellow zone only by 1 point of our index. And number two, all the measures we were monitoring had worsened compared to the previous week. So we decided to wait 1 more week, which would be this week, and see if the yellow zone trend would continue, then we were going to consider lifting some of the measures. Unfortunately, that trend has not continued. But that's the goal. So when we can bring the transmission rates down to a level that can be managed and can be safer for our community, then we will start removing some of those restrictions. And it will be a progressive process. We are
Now,
not
when-
going to remove all of them
When we do a
at
mass
once.
testing, such as the Department of Corrections or at a nursing home facility, and we might go through and test the entire population, does that inflate the number to a point to where, or does it just become that we're more aware of what that number actually was?
I don't think that makes a huge difference in the grand scheme of things. We monitor the number of tests that are administered in Shawnee County, and it's been pretty steady. In the last several weeks, it's been pretty steady, between 2,800 and 3,000 every week. So yeah, you may have a mass screening in a jail, but the week before you had a mass screening in some nursing homes, and actually now nursing homes are screening on a regular basis. So I don't think that our numbers really are affected significantly by those kind of initiatives.
Are all of our cases lab tested?
Absolutely, yes.
Okay, good. When they're doing testing, now I was reading the other night that they're looking for the DNA of the COVID. That's what and they keep looking, and if they go, it may have a score of like 30, which means they went through it 30 times before they found a trace of the DNA. And some of these, when they get higher than that, they have so little DNA, and they're really not transmittable at that point. We don't know what our numbers are on our case, how severe the cases are.
You are absolutely right, and that's a very intriguing concept that has been debated for the last several weeks in medical journals and forums of healthcare providers and public health specialists. Nobody really knows what the appropriate threshold would be. So in other words, what happens, as you explained, they amplify the genetic material from the virus multiple times, and up until a point where either they reach a predetermined number of times that they try to do that, or they detect the virus. The number, I think, right now goes between 25 and 30 times, or fewer times if they detect the virus. Nobody really knows what that appropriate number should be, and so the number is not even reported most of the time in the lab results. They just report, viral material detected or not. So from our point of view, there is nothing we can do about it. We are just, I'm following that debate carefully, and once again, if those recommendations make it into the main public health practice, we will certainly act accordingly. But right now, it's just a conversation about scientists.
Mr. Chair.
Yes.
Dr. Pacino, thanks for being here, by the way. I'm still a little concerned about this, the statistic category, the percent of cases with no known source of infection, and the number of people that are not willing to cooperate with the contact tracers. At some point, I feel that we probably need to take that into consideration when tabulating that number. Because as that number grows, the people that are not willing to participate, I think our likelihood of ever getting that category below 50% is virtually nothing. And so, I mean, that's something that's still concerning to me in some ways. But then also, I guess I have a question of the people who do participate in the contact tracing, what percentage of those people are we finding a known source of infection or not?
Okay, for the first part of your question, I agree with you. We are not at the level yet where I think that the number is going to skew our index considerably. I try to remember, I think we are still below 20% of people who refuse to participate in interview, but if the number rises anymore, I think we probably want to take it out of the equation and just see for the people we can talk to, for how many we can identify the source of infection. I'm not sure I totally follow your second part of the question, because that's exactly what we are trying to do. So essentially, the people for whom we know a source of infection are either contacts that had been identified from previous cases or are people linked to a cluster that is already a known cluster. So I'm sorry, but am I missing something in your question?
I guess what I'm saying is that the 20% of folks that are not cooperating with the contact tracing, we're including those in the number.
Yes.
So
Right now we are.
I guess what I'm saying is that perhaps our sample size is too large. If we throw out the 20% that are unwilling to cooperate and only assess the people that are cooperating, do we have an idea of what that percentage is? Because it seems like that would be a more accurate number
Yes.
to be using in our scorecard.
Yes, yes. And as I said, the number is still not very high, so we did look at the data in both ways. It doesn't change very much, but your point is well taken. So I will look at the data again, and probably we may reach a point where we may decide to remove the number from the total.
Okay, my other question, thank you, by the way. My other question is, you have mentioned that a lot has changed since March. One thing that hasn't really changed much since March is our dashboard. And I have asked about this before, but are we going to update the dashboard? It's not really user-friendly in its current form. I mean, the charts are not really accessible on cell phones. It's hard to dive into the data very much. And I know that there are other counties that are using more sophisticated dashboards. Is that something that we're using our CARES Act funding to do at some point?
Yeah, I will tell you what I know. I don't know if Linda Oaks has anything she wants to add, but we have been working for the last several weeks to update the dashboard, and my understanding is that the new dashboard should be online in the next few days, probably as early as next week. There will be a two-stage improvement or enhancement process there. In the first stage, you will see some of the same elements that are in the current dashboard, but just reorganized in a way that's a little easier to follow, and a couple of additional elements. In the second phase, we want to add some additional information, especially age group breakdown, which I know is something that many of us have been wanting to see. So we are working with our county IT department to make all of that happen. And I don't know if there is anything, Linda, you want to add to that.
I know I would like to see age groups and recovery rate as well as hospitalization rates on that dashboard. Dr. Pizzin, I had another question for you about.
Can I comment on the dashboard?
Sure.
Real fast?
Let's finish up this
Good morning,
question.
Commissioners. Linda Oaks from the Health Department. That dashboard is actually, we're using ArcGIS, which is through our GIS department here at Shawnee County. So Lee Allen is helping us when he can, in the middle of his other duties. So that's part of it, is just capacity. We are going to update it. It's still going to be ArcGIS. So it's probably still not going to be exactly what you're hoping for. We have talked about going to something like Tableau. Super expensive, super hard to use. I think the learning curve for, again, our small epidemiology department, which is one person right now, to try to learn that, it would be a lot. And so we'll keep talking about it, and we're certainly open to it. Tableau is what KDHE uses. I find their charts also feel difficult to use and difficult to look at, and so it's just one of those things where we're just trying to balance. So, but I think what we're going to be rolling out, hopefully Monday, will be a little clearer on the numbers, and then we can keep looking at it and keep talking about improvements. So
okay.
I hope that
Thank
helps.
Our new cases, are we seeing them in pockets, or are they just all over the board?
You mean within the county, geographically?
Yes, in our county, are we?
Yeah, we don't really see any pockets. I think
No
our
hot spots?
I mean, we had hotspots that are usually localized, not in terms of geographical localization, but more in terms of workplace or nursing homes or schools or manufacturing plants, but not by zip code, if that's what you're referring to.
No, I'm just talking about like a manufacturing place or a nursing home.
Yeah. Oh, we have clusters, not very big at this point, but as you probably remember, a few weeks ago, we had several clusters in nursing homes, and most of them have been brought down, either stopped together, altogether brought down to much smaller size.
Isn't it true, though, too, with a virus like this, the longer you're into this, the harder it is to contact trace. It becomes to a point where
Yeah.
You don't
It's
know
true.
where
I mean,
anybody
once we get into, if we are into the red zone for several weeks in a row, I have no idea what kind of contact tracing we'll be able to do.
So I look at the graph here, and I wonder, are we putting too much emphasis and weight on where are they getting the virus? Is that?
Right now, that is considered the standard of care for public health. Essentially, it's the equivalent of a standard of care in clinical medicine for public health. Contact tracing, prompt case investigation, and testing. Actually, in the reverse order, probably. Testing, prompt identification of cases, and then contact tracing. As I said, if those standards change, we will adjust our interventions accordingly.
Are you familiar with the Great Barrington Declaration that came out October 6th?
No.
Okay, this was the result of a recent conference from the American Institute of Economic Research. It was primarily authored by 3 epidemiologists. One was from Harvard University, they're epidemiologist professors. One was from Oxford University and one was from Stanford. It was co-signed off by more than 800 medical and public health scientists and medical practitioners. And their findings was the crackdown policies are producing devastating effects on short and long-term public health. The results include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health. It's kind of grim. It's what they come up with. So a lot of these people, they said, one of the professors said lockdowns and contact tracing focuses on the wrong thing. Dr. Fauci's suggestion of mass testing is inefficient use of limited resource. Testing every one strategy is not good. Protect the vulnerable. Let the non-vulnerable live their lives, schools, activities, churches, and build immunity so that in a few months, built immunity will serve to protect the vulnerable and then they can resume life. The doctor from Stanford said, to deny herd immunity is like denying gravity. Lockdowns do not come without great cost to health and lives. Do we focus on protection plan, or do a focused protection plan and let others live their lives? And so, I think some of the conventional wisdom that we've had in the past is changing on this, and I don't know.
It's possible, Commissioner. As I said, I wasn't familiar with that particular declaration, but I'm familiar with those arguments, of course, and I'm very interested in following how they're going to develop. Right now, the mainstream public health approach that's recommended by the CDC and by our state is one where testing, case identification, and contact tracing still remain the key elements for intervention in public health. When that changes, we will examine things accordingly. Don't forget, incidentally, we are required by law to do, these kind of interventions, the state law, because that's what the health officer and the health department have to do when there is an infectious disease. Okay. If I may, I would like to add 2 more things. One more on a personal note, because Commissioner Rippon, you and I have talked multiple times, and you invited me to share some good news, and I think you have a good point. Sometimes epidemiologists tend to focus on the problem and not on the positive aspects. So I already talked about the schools, and I think that's good news for us, but I want to share a few elements at the personal level, just to reiterate the message that this is not a death sentence, and we should not be on self-imposed lockdown. Not all of us, certainly. And so, I am in the high-risk category because of my age. I'm a relatively healthy person, but I am older than 65. And I have resumed pretty much almost my regular life in many aspects, with some differences, some adjustments. Last week I went back to a concert, an indoor symphony concert for the first time since March. It was great. People were socially distancing, and I felt very safe. I go out and dine. I'm careful the way I pick my places. I try to do outdoors as much as I can rather than indoors. I had 2 quick vacation trips in the last couple of months. I didn't fly, I drove, but it was still good vacation time. You know, I picked the right hotel, or I stayed in a bed and breakfast that have good reputation. So all that to say that there is a way to run our lives, maybe not exactly the way it was back in February, but certainly very different from where we were in March and April and part of May. And I think social activity, social networking are absolutely vital. I mean, your concern, Commissioner, are well taken about, you know, the effect of lack of social networking and on people. We are all social animals, and so we all need to do our personal risk assessment. I've done mine. I'm not recommending that everybody does the same things I just solicited I did, but I encourage people to do indeed perform a personal risk assessment, keeping in mind that there are ways now that we can do many things safer than a few months ago and still feel pretty safe from the virus. So that's the first element I wanted to share. We shouldn't all be in self-imposed lockdown. That's not something I'm recommending. The second thing I wanted to share, unfortunately, that is not good news, and it's about deaths in Shawnee County because of COVID-19. As you know, that's one of the indicators that's in the dashboard. And today, we are going to add several deaths to the number, over 20 deaths. And I want to explain to you why we are adding those deaths, and I want to emphasize the fact that those are not recent deaths. So we haven't had an outbreak of deaths from COVID-19 in Shawnee County in the past few days. We are just improving the way that we are counting those deaths. And this is what happened. It may come as a surprise to some of us, but there is really no quick, real-time, reliable way to count deaths from any kind of condition. Deaths are usually counted at the end of the year by the Office of Vital Statistics for the state and at the national level, the National Center for Health Statistics, and they're counted from death certificates. And it takes time for those death certificates to be filed, cleaned up, analyzed, and so on. Reports typically are published about 12 to 18 months after the closing of a certain calendar year. Obviously, that wouldn't help us very much in the case of COVID. We want to have a way to do a more real-time tracking of those deaths. So what we did since the beginning, what we have done was to collect reports from hospitals and nursing homes, the places where it's likely that people are going to die, and count those as provisional deaths until then they're verified by KDHE or you know, we learn that they were not deaths related to COVID-19. And that's what I call a kind of anecdotal reporting system. That worked pretty well at the beginning because, again, we have few cases and we have few deaths. The more cases we got and the more deaths we accumulated, the harder it became to track all of them using this sort of informal network with hospitals and nursing homes. So we decided to, we started to hear reports, for example, from family members who were calling us say, hey, my dear one just died, and I saw that your death count hasn't been updated, but I know there was a death from COVID-19. So we decided to look a little closer at our data. And we have an electronic disease reporting system. So all the cases of COVID-19 are included in the system. It's actually something that the state manages. We only have access to our county data. And the state and we also updates whenever a patient dies, but without any further verification of the cause of death certificate, just because they know the patient died, they update it. So we ran a report from the system, and the system showed all the patients that had a diagnosis of COVID-19 who died. And we had more than 20 patients in excess to the number of deaths that we had identified. Then we investigated those deaths even more. We went back to KDHE. We asked them to verify those with us. We checked the medical records when we had access to them through our hospitals. We checked with the nursing homes. So as a result, we decided that many of those deaths should be added to our count of provisional deaths. Now, the key word is provisional. And so as a result, what you're going to see on the dashboard today is going to be our total number of deaths jumping to 60. But again, that is something that happened progressively over time. The reason we are adding all these deaths all at once is because of limitation in the data collection system and the way that the information was being reported to us. And moving forward, what we are going to do, we are going to consider any death that happens within 30 days from a diagnosis of COVID-19 as a provisional, the key word is provisional, COVID-19 death until otherwise proven. And we will do our due diligence. We will call the hospital. For example, if somebody was diagnosed with COVID-19 and dies from a car accident, we are not going to count that. So we will try to verify that information with our hospitals, with our nursing homes. But if we have no alternative explanation for the death, and the death happened within 30 days from the diagnosis, it's going to be counted as a COVID-19 provisionally until KDHE can pull the death certificate, verify the information from the coroner or the certifying physician, and confirm whether that was indeed a COVID-19 death or not. If they say, no, this was not, we will remove that unit, that record from the count. It's a little complex issue. I hope I didn't lose anybody, but I wanted to give a heads up that that's what's going to happen with our dashboard.
So these deaths are likely deaths. These aren't confirmed. I know when the CDC put out some numbers here recently that said that of all the COVID deaths in the United States, only 6% were strictly COVID deaths. The rest of them had comorbidity. They had something else going on. That's a pretty huge number.
Can I respond to that real quick, Commissioner?
Yeah.
Yes, the CDC put out a report, but that's not what the report said. That's how the report was interpreted by some people. The report said that only in a small fraction of deaths, COVID-19 was listed as the only cause of death.
Right.
In every other case, COVID-19 was listed but as the underlying cause that had led to a death. So those were still COVID-19 deaths.
Possibly.
Well, if you believe the death certificate, that's our gold standard.
Comorbidity is comorbidity. I mean, you have more than one cause.
The question I ask when I discuss that with coronary physicians is, would the person have lived longer without the COVID-19 infection? That's really my rule of thumb. If the answer is no, then to me that's not COVID-19 related. If the answer is yes, then it is related to COVID-19. Even if the person was going to die, we don't know when the person would have died. We don't know how long. Sure, they had underlying condition, they may have died soon, but we don't know. If the judgment of the treating physician or the coroner is that the life of the person had been shortened, to me that counts as a COVID-19 related death.
I guess the reverse of that is, would they have lived had they not had a heart condition? So anyway, so we're counting deaths that we really haven't confirmed.
That's why we call them provisional.
Provisional. And why don't we wait to look at the autopsy report or the coroner's report before we count them as deaths?
The main reason, for two reasons. First of all, as I said, it may take up to 18 months sometime to get those information. You know, you are one who's very interested in knowing the number of deaths that take place, and of all people, I thought you would jump on the idea of having more real-time data, but the reason is that the vast majority of those provisional deaths, once we go through the verification process, then are counted as COVID-19 related deaths in the final count. So we think that the small error that we introduced by counting the provisional deaths is compensated by the fact that we can have real-time data that is more actionable data. I would want to know if our death rates increase dramatically. I want to know now. I don't want to know after 18 months.
Yeah. But I want to be accurate, too.
Yeah, and that's why we call it provisional.
I don't want
most of them will be confirmed.
Speculation when we think he died. Do hospitals get funding from the federal government for a death, a COVID death?
I'm not aware of any.
All right.
Mr. Chairman?
Yes.
Doctor, I'm a little bit concerned about the immediate increase. I mean, we're talking about almost a doubling of our reported COVID deaths overnight. Even though none have occurred overnight, the way that it's being reported is doubled overnight. Why not sanction those out as confirmed versus provisional, so that we have a clear distinction between these are the numbers, but we're still waiting on results for these. So at least the numbers are out there. We have transparency, but they're pending final analysis. Because I'm concerned about it looking, it's public trust. Once you break public trust, it's very difficult, if not impossible, to regain. And so if our number goes from 34 to 60, back down to 50 overnight, that is going to leave a lot of people wondering, can we trust our county government? Can we trust our health officer? Why not sanction out those that we know and we've confirmed from those that are provisional? And at least have both reported.
Mm-hmm.
So there is transparency, but again, instead of just lumping them all in as being a final number.
First of all, I do understand the issue of trust very much and very well, and that's a valid point. I want to point out that this situation surfaced because of the complex web of interactions among different parties. And I don't want to point fingers at anybody in particular, but there was some reluctance in some cases, I'll be honest. There was some reluctance on the part of some institutions to report deaths. And so there was no way for us to learn that those deaths had occurred. So I don't want to give anybody the impression that it's because we don't know how to count up to 60. We do know how to count. It's just there isn't a reliable system in place to count deaths in a good way. The vast majority of those deaths will end up being confirmed, but I will look into the suggestion that you have. I think there is still a value in having a total provisional number, and then maybe have a breakdown and show how many of those have been confirmed and how many are still subject to the confirmation process.
Commissioner Mays?
Dr. Pizzino, when these deaths are added to the dashboard, are they all going to be added as if they died yesterday? Or are we going to go back and add them on the days that they actually were deceased?
Right.
I feel like when looking at the charts and the graphs of the timeline, that would make a huge difference. I know we had a situation a week or two ago where we added, 50 recoveries to the dashboard in one day. And while not all those people recovered on that day, it sure looks like it when you look at the graphs. And so I guess my request would be that when we do issue these, that we can go back into that timeline and put them in their accurate places so we can, at least see the curve of where things are headed.
Yeah, no, you're absolutely right, and that will be done. We know the date of death for these people now. I don't think the dashboard has a chart of deaths by time, but if it does,
it's
those
in that
deaths will be
aggregated chart
okay,
that has
then
all
those
of
deaths
the...
will be attributed to the appropriate week or month or day when the people were deceased.
Okay.
What you have in the front page is just a cumulative total since March, and that would be that would be the 60, but it will not appear like 20-some people died yesterday. No.
Okay, thank you.
Do you know what the average age of the person who dies of COVID is in this county?
Most deaths occurred in people who are 70, 75 and older.
Okay. I'm kind of the same ilk as Commissioner Mays.
Wow, I didn't know that.
Suddenly you've been thrown into the fire here. No. I'm concerned about all of it showing up at once, too. I think that's going to scare people, and I think with this virus, it's easier to scare people than educate them. I'm convinced of that, and I don't want to go down that road.
Well, we believe that is the best number that we can give right now. That is the most accurate estimate of deaths that we can give, and we feel it's our obligation not to sit or hide the number. And that's why we have this. We will have a press release that explains why we are adding those deaths. We will be available for media contacts and explanations. That's why I was here today to bring this up. So it's important that people understand what's going on and what is not going on.
Okay.
I mean, Mr. Chairman.
Yes.
I think that what Dr. Pizzino alluded to is an issue that we probably should address head-on. No hospital wants to be known where everyone goes to die, but many people die at hospitals. No nursing home wants to be known as the cluster for the COVID, although there are clusters in nursing homes. No school wants to be known as the super spreader, but there will be transmission rates. It's inevitable that there will be some transmission rates among schools. And I think that the more honest these institutions are, whether it's a hospital, a nursing home, or a school, it protects all of us. And I am concerned about the scarlet letter that is cast upon many institutions and businesses that they are refusing to report or participate because of the negativity that it may come to their business or institution. And so I think that we do need to have that, again, trust is hard to gain and easy to lose. But the more reporting that we have, more accurate picture, the quicker we can get to a lower level and remove these restrictions.
Now, I have no doubt we'll have more cases in schools, but you know, this is the healthiest population that we have. And I read the hospitalization rates. I mean, it's very low, and it's part of herd immunity. Actually, even if you have a vaccine, that's kind of a form of herd immunity when you do vaccines. So, I don't know. Yeah, I don't want to scare anybody at all, but I think we do need to be as transparent as we can and present the facts. In my mind, there's such a thing as silent propaganda too. You have to tell all the numbers. Tell these hospitalization rates. Tell the death rates. When people see those numbers, I think it's less scary, and I think we need to show that. So,
Once again, those numbers are on our dashboard, and there will be even more in the upcoming days.
okay.
Thank you, Commissioners.
Thank you.
Commissioners, just a reminder about registrations. On Friday, we will be having our registration drive at the Shawnee County Public Library, 9 a.m. to 5:30 p.m. Saturday, 9 to 5:30 as well, and then Sunday from noon to 5 p.m. So if people want to check your registration status, get a hold of your details, make sure you're up to date, you're welcome to stop by there. Again, just encouraging people to register to vote. Thanks.
Thank you. Yes.
Hey, Andrew, can you make sure that Amanda has all those numbers to put on the Shawnee County webpage?
We will do that.
Thanks.
Okay. Anyone else? Commissioner Mays?
Nothing from me
What have you
today.
been up to? Commissioner Cook?
We had a great ribbon cutting and rededication at the Hillcrest Community Center on Monday. Thank you, commissioners, for attending. Thank you for Tim and your staff and everything that you've done, and it turned out very well. It was very well attended, and I think the community was very impressed with the changes that have been made. And I think that it shows that, you know, Shawnee County, we are very committed to making sure that our quality of life is continuing to be addressed, and that I look forward to doing more of these in the future. So thank you to Tim and staff, and thank you, commissioners.
Thank you. Well, I volunteered out at Garden Glow one evening, and had a great crowd. I think people just had a wonderful time out there. If you haven't been to Garden Glow, you should go out there. It's runs for a few more days, I think. Tim, you still here? Put you on the spot here.
Yeah, Tim Laurent, Parks and Recreation. Yeah, I think it runs through the 11th is that correct? Yeah, through the 11th, and it's in the evening from 7 to 9, 7 to 10. In the evening starting at 7 o'clock, and it's $5 to get in. So yeah, it's had rave reviews so far and got a lot of good positive feedback, and I'll be heading out there with my family this weekend. So
It's a great event for all ages, so
Yeah.
please go out.
Yeah, a lot of fun.
We do not have a need for executive session, so we are adjourned.